Good afternoon. My name is Paul Edwards with the Governor's Office, and I'd like to welcome everyone to today's briefing on the COVID-19 pandemic crisis. The first speaker that we'll have today, we'll first hear from Governor Gary R. Herbert, and he'll take questions following his presentation. He'll be followed by Val Hale, who is the Executive Director of the Governor's Office of Economic Development. And then we'll hear from Dr. Anegla Dunn, who is the state epidemiologist. Governor Herbert.
Well, thank you, Paul, as always, and thanks to everybody for tuning in today. Appreciate the media. I certainly want to say thanks to all of Utah for the work they've done during extraordinary, uncertain, difficult times. This is where you find out the true character of the people, and the fact that we've been willing to cooperate and work together in an unprecedented way, I think, is really proven to be the secret ingredient to our success, as we do see opportunities now as we open up the economy to have a recovery. It's in our distant future, or in our short-term future here, I think, as we've gone from red to orange, from high risk to moderate risk, and I think we're going to have the opportunity here in the next few weeks to go to yellow, light risk, and then finally to get into full-blown recovery. So we can't thank everybody enough. There are some issues we'd like to discuss today and add some clarification and some points that might help people to understand. For example, I've noticed there's a headline about confirmed COVID-19 cases in Utah continue to rise. And I hear from Paul, Dr. Dunn will be here later on. She can probably explain some of that in greater detail. But it's important to note that we've increased our testing. And there's a correlation between the number of cases that we find and confirm based to our testing numbers. And so the more testing, the more we'll find. It stays pretty constant. We've actually reduced down from 5% in the beginning to about 4.2% now. And that's a good sign, actually. And of course, we'd like to have everybody tested so we know exactly where the coronavirus is and where it is not. And then we can have a better attempt at trying to isolate those who have it and keep it from spreading. I appreciate the fact that our testing volumes have increased dramatically, and that's a good thing. By the way, our transmission rate now is down to about 1 to 1. That means for every person who's got it, they'll infect one others. That is really a stabilization rate, which is we know we're going into right now as we transition from red to orange. So that's a good sign. The other good sign that we need to really appreciate our friends in the healthcare industry, what they've done to help us of their own volition. Again, this spirit of cooperation and collaboration. Our hospital capacity is up. We now open it up to elective surgery, but our hospital capacity is very in good shape. Our PPEs, our personal protective equipment, resources are now robust. They were very short supply in the beginning, but because of the efforts of many people, we are in good shape now, and so we have the headroom necessary to make sure that no matter what happens in the future, that we'll not be overwhelmed with our healthcare system with those who have the COVID-19. Our testing, in fact, has received accolades from other parts of the country. The latest just came out from Harvard University that talks about our ability to have testing. And now this new, and we'll talk maybe about this a little later, antibody testing that we're going to be doing out of the University of Utah and through the ARUP folks, gives us really an ability to understand better, to gather information of how the virus is impacting our state. We have a strong program on test and tracing, again, to be able to see who's been touched by somebody who's infected and what we can do to isolate them. And we have because of that ability, one of the lowest fatality rates in the nation. Now, it's one death is one too many, and we see that number growing as people have been infected. But at least in comparison, as we see the number of deaths, we have the lowest number of deaths per confirmed cases in the United States. We have around just slightly less than 1%. The national average, by the way, is 5.9%. Areas like New York City are over 7%. So when we're, 1/6 of what's taking place in the nation, at least something is working right. And I feel good about all those who've made this to happen. This is by design, of course, and by efforts of many people. We need to continue to keep our vigilance up and make sure that we do what we need to be doing for the directions of social distancing, et cetera, to keep this trend in the right direction. Our testing now is the 4th highest number of tests administered in the nation. Again, that helps us get on top of where the coronavirus is at. Our contact tracing, we determined that 82% of our cases, we know where they come from. It's not unknown, which helps us again. A majority of them seem to be coming from household contacts, and that means that our exposure outside is slowing down. That's a good thing. So a lot of good news here to see the efforts we've been making. I've mentioned here just a minute ago the launch of the University of Utah's HERO program. They're going to reach out and do random testing for 10,000 Utahns. And that'll be a blood test, antibody test, will help us to know whether people have had it and maybe didn't know it. And there seems to be some sectors of our society that they were maybe slightly ill or didn't even know they were ill, but actually contracted the COVID-19. So this will help us with information as we go forward. Let me mention this too. The most recent reported 7-week period of unemployment, again, we're very concerned about the economy and the downturn that we've had here, and that's been a challenge for all of us. We all feel the impacts of the economy slowing down. We had unemployment insurance claims from March 15th to March 2nd, from March 15th to May 2nd, of about 147,000 people applied for unemployment insurance. That represents about 9.5% of the people employed, but a significant drop. Compared to the national average, though, which had the same period of time about a 20% drop. So again, I think it illustrates the strength of our economy, the fundamentals we have in place before the COVID-19. And the good news for us is that those fundamentals are still in place. And so as we get through this dangerous time right now and work towards stabilization, then into recovery, I think we can feel optimistic. It certainly gives me confidence that we've moved from red to orange, and we're going to have an opportunity here in a few weeks to move from orange to yellow and then yellow to green and be in recovery mode. I don't think the economy is going to recover in a kind of a V shape. Some have talked about that. We had a precipitous drop, and we'll have a very significant incline to recover. I'm not sure that's what I see, and as I talk to the economists, I don't know there'll be a U shape either. But I think in my mind, I see kind of the Nike swoosh. We've had this down, and now we're going to have this gradual but steady and hopefully robust recovery when we get past the summer months and into recovery mode. So I'm very cautiously optimistic about where we're at and where we're going. Again, the fundamentals of a good tax policy, competitive tax rates, regulation reform, efficiency in government, all those fundamentals that made us the best and most healthy, diverse economy in America for the last 3 years are still in place. So I believe that we're going to have the most robust and recover quicker and better than any state in America today. We'll get back to where we were over a period of time, and I think we'll see some of that happen by the end of the summer, at least that trend. So that's a lot of good news, and I appreciate the work of so many people in getting us to that point. Now, let me talk about some other issues that I think are important. Again, as we've seen significant progress in the state in slowing the spread of the coronavirus, and we're able to get our economy starting to open up and get back on track, just as the economy is moving out of the urgency phase into more stabilization, our state operations are having that same opportunity. Unquestionably, this crisis is not over. I like the trend, I like the direction we're going, but the crisis is still here with us. But I believe that our furiously paced decision-making has steadied. we have a little more of calm. It's not the fast and furious situation we found ourselves here the last few weeks. And I'm grateful that we now have a little bit of breathing room. We can sit back and kind of reflect and evaluate, how we did it and what we did and what we can learn from that. Certainly for future opportunities, if we have crises that may come or another wave of the COVID-19, again, an opportunity for us to reflect and evaluate is important. So let me add some of my thoughts and reflection here to enter in with the public discourse that's going on. One, I believe there are legitimate questions that have been raised about various contracts that have been entered into by the state as we declared a state of emergency. In that statement, we've rallied the people together, both to deal with the health care issues as well as economic issues that have been posed by the COVID-19 virus. Certainly, for any questions that may be out there, we will cooperate with any legitimate inquiries to evaluate and to learn from the decisions that have been made, and hopefully help us going forward in the correct direction and make sure that we're doing things to the best of our ability. I think there is much that can be learned from our experience here and what we've gone through, and yet to go through. This is not over, and there's still more to be done. And again, as I mentioned, this will help us in preparation for the future for other potential crises that may come, and we'll be better prepared for that. I would like to emphasize this. Make no mistake about it, what we've gone through these last 8 weeks as the coronavirus entered into our community, Utah has become part of a very significant international health emergency. Not only an international healthcare emergency, but of unprecedented proportion. It's the worst that any of us have seen in our lifetime. And unfortunately for us, there's not been any playbook to look and research to help guide us as we try to find our way through this challenging time. Now, Utah is no stranger to emergencies. We've had many in our past, and our state systems have been set up to deal with these emergencies. We have the Be Ready Utah program, which I started when I was lieutenant governor, which serves us very well for many different ways and help the people be prepared. But we're well honed to address things like fire, flood, earthquake. But those are situations which really are of relatively short duration, and we see a beginning and we see the end, and they are contained to regions of the state and specific locations. So the same systems that helped us address those in the times of past are not really designed well to help us with this invasion of an invisible, transmissible, and deadly virus of unknown duration. There is no playbook on how to handle this. It's never happened before, so we are discovering as we go. When I was inaugurated back in August of 2009, we were in the depths of the Great Recession, the worst economic times in Utah's history since the Great Depression. Again, a little bit of unprecedented challenge that we'd had before. And so as we tried to emphasize our path forward, we knew it would require actively listening to those experts out there in the field to help us, evaluating the challenges that we were facing, collaborating with other people to address every challenge that came on our horizon, some unforeseen, and in doing so, creating unprecedented partnerships. The ability for us to work together with all people, public and private, together. And so, in typical Utah fashion, we rolled up our sleeves and we said, let's get to work. We're not going to shrink from this. We're not going to be undaunted because of the task ahead of us, because of the uncertainty unknown. And the state of Utah is led out in dealing with this crisis as well, if not better than any state in America today. I've given some stats that would emphasize that. I've had calls just this week from 3 other governors to ask, what are we doing? What can they find from our experience? Because they see the numbers and they see that Utah is doing better than most. So we knew we couldn't wait. Again, it's not our nature to wait for somebody else to come. And one of our pillars of success in Utah is self-determination. And so we couldn't wait for the federal government to figure a solution. They've been a little slow and clumsy in their activation. We knew that state government couldn't do it alone either. Government has a lot to do and a role to play, but some of the needs we had came from the private sector. We couldn't accomplish it so we locked arms with local government, with universities, our research institutions, our healthcare institutions, our hospitals, nonprofit organizations, and with the private sector to respond in a data-informed way. To develop plans. In fact, we developed the most comprehensive plan to address this in America today. Utah leads together. The first version, now we're at 2.0, and in a couple of weeks we'll roll out the third iteration of this as we learn as we go and make refinements in how we're going to address the coronavirus issue. This is, in fact, the Utah way. So the last 2 months have been an all-hands-on-deck effort, everybody helping out. Led by state employees and led by the private sector as we've learned to work together in our respective roles under new and I would say very unique circumstances to create what we would call unprecedented partnerships and working together that enable us, in fact, to be more effectively, to be the most effective we can in addressing and confronting the challenges of today, and not only just today, but the foreseeable future. This is not only about what we need for now in the immediate time, but also what we need in the future as we go forward. Let me give you just one example. We knew that testing and tracing was going to be a top of the list need. It still continues to be around the country a challenge for many states, in fact, to get on top of the testing and tracing that is vitally important to being able to corral and slow the flow of the coronavirus and, in fact, help us save people's lives. As I mentioned, there was no playbook. This has never been done before, and so we didn't, where do you go to find out instructions of how to deal with this? How do we ramp up statewide capacity, for example, in every area, especially in a time when we have such significant global supply chains being fractured? What we normally would do was all of a sudden being disrupted. In fact, it became really dysfunctional. And so the loss of supply chains, the demand and need of a sense of urgency, we need it now to get ahead of this problem, it was a real challenge. But again, Utah jumped into action. We began to adapt to the challenges of the day and innovate and find ways to address these issues. We worked with significant numbers of organizations and suppliers to find a way to solve some of these problems. And some of these that we partnered with are legacy organizations. Some of them are startups. Some of them, from our research institutions helping us. We talked about the testing from the University of Utah. It was really virtually all hands on deck, and let's see if we can't find a way to build up testing capacity that has made Utah, by the way, we see the results of this dramatic effort. The results is that we're one of the top testing states in the nation. We're fourth highest in testing rates in the nation today. I mentioned, I think earlier, the Harvard study talks about us being so successful. Many are looking to Utah as the example of what we've been able to accomplish in really an 8-week period of time. When you think about the shortness of the time, it is pretty remarkable what we've done in that short period of time. Helping to slow the spread of the coronavirus and to save lives this way has required literally thousands of individual decisions, choices, and judgment calls. Thousands. And again, there's not anything to look in the reference book to see what the decision should be. It's kind of learning as we go. By the way, decisions were having to be made with little time to spare in an emergency type situation. We need it now. We can't wait for tomorrow. We need to make those decisions now if we're going to, in fact, find a solution to the problem. I'll just say this. Has there been unanimity in all the decisions that we've made by our Utah leaders? And the answer is no. There have been principled and sincere, I think, differences of opinion, but they are opinions, and I understand that. We've had to work on the best information we had. I can tell you this, there has always been a common purpose. There's always been a united effort to see what can we do to slow the spread of this coronavirus, to save people's lives and their livelihood. That's something we've been united and joined at the hip 110%. We might have difference of opinion how to get there and what's the right way. Was every decision the best decision? Probably not. I think it's human nature for all of us to want to kind of Monday morning quarterback, as we say. I think we all want to take a look back. And certainly with the benefit of hindsight, it's easy to say, well, we should have done this or that or the other thing. But given the constraints and the uncertainties of the moment and the urgencies that we faced at the time, I stand by the collective decisions that have been made by our state's leaders. I think they've made their correct decisions with the best information they had available at the time in order to address our common goal of saving lives, saving livelihoods, stopping the spread of this coronavirus. Now, the results we see, it's worked. I mean, as maybe imperfect as we may be in the process and some of the communication gaffes that we've made and gaps that are there, we see the results of this effort. We are in a good place as a state, certainly in comparison to other states in America. We're at the top of the list. But let me just emphasize, we're still in the middle of a crisis. This has not gone away, and we're doing and fighting the good fight here, and I think we're winning, but we're still in the middle of the crisis. So let me reiterate what I've said before here to the people of Utah. My administration will continue to fight the good fight in collaboration with others out there that are fighting the good fight shoulder to shoulder. We're trying to find ways to make it better for the people. My administration will continue to be responsive to any questions that may come up, any legitimate inquiries about what we're doing and how we're doing it. We'll also seek input and evaluation. We're certainly willing to take suggestions and recommendations to find a better way. We'll learn from those decisions, and we will continue to make those improvements as we fight this coronavirus problem. Let me just conclude with saying this. We are deeply committed to be good stewards of the taxpayers' funds, and that includes the federal monies that we come, and there's certainly a lot of it coming. But we understand the responsibility we have to spend the money as effectively and efficiently as possible with the goal in mind to slow the spread and stop the spread of the coronavirus, to save people's lives and their livelihood. It's really that three-pronged goal. That's the object. That's the end in mind that we're working towards. And so as we are committed to be good stewards of the funds and make sure that we spend the monies appropriately, we will continue. By the way, the funds we're talking about mostly are all the CARE Act funds that Washington has sent to the respective states. These funds can only be expended in appropriate ways as they outline them for COVID-19 issues that are related. Can't be spent for any other good and noble causes out there, which there are many. This is for one purpose and one purpose only. And by the way, they need to be spent by the end of the year, by December of 31. December 31st is the last day. So use it or lose it. It's kind of what they've set it up. I don't know that I agree with that, but we have to play by the rules that Congress has set up. And so those monies, we're trying to be as judicious in the expenditure of the money and getting the results that we all desire in our efforts. We know that whether they're federal tax dollars or they're Utah tax dollars, they come from the taxpayer. And we have a responsibility and hold them in trust to spend those monies the way the taxpayer would like to do, and we are. Let me be very clear that if in fact we find any instance of someone who's engaged in some kind of fraud, price gouging, or self-dealing with state resources, I will use the full weight of my office as the governor to make sure that those people are held accountable. But on the same token, let me say, I also stand by those who have worked tirelessly already, who stepped forward heroically to answer the call of duty to help those who need help, to help us with our goal of stopping the spread of the coronavirus and protect people's lives and their livelihood. And we appreciate those who have stepped forward. It's not an easy thing to do, as you can understand, and the uncertainty and the urgency all combine to make this a unique emergency in our state's history. With that, before I open up to questions, let me just speak a little bit about the future and the processes that we'll have going forward. We've seen the past 8 weeks. We've got some good results of what we've done. I expect that we'll continue to have good positive results as we go forward. But the COVID-19, as you know, we set up a unified command center, and that's headed here by our Commissioner of Public Safety, Jess Anderson. That was started in late March, and they have full now operational authority over our state operations related to this pandemic, and that will include contracting. So any of the contracting we do. Moving forward, any contracts related to the COVID-19 that are executed outside of that command structure are now being brought under the Unified Incident Command. And now, thankfully, that the pace of purchases has calmed down, I've asked the Unified Command to use a more normal purchasing process, even though we still remain in a state of emergency. We don't have quite the time-sensitive issues that we've had in the past. As we now move into stabilization, I think that's good news for all of us. Certainly shows we're winning the battle. And as to the contracts that have already been executed in the past few months, Commissioner Anderson will invite credentialed Capitol Hill media to come and participate with him the first of next week, and kind of a Q&A and an opportunity for him to show background and context for what we've done in the past and what we'll be doing as we go forward into the future. He'll walk through some of the detail and the breadth and depth of the challenge that we've faced in our state's emergency procurements and the issues that have raised some questions. There have been over 300 purchases made under 73 different vendors during this emergency. The numbers are somewhat staggering, but that's kind of the essence of this emergency, unprecedented that it may be, and wanting to get on top of this before we have a spread that we cannot control and have a worse pandemic than we have already. All of the federal CARES Act monies, by the way, that we've spent, the numbers you've heard, have been dedicated to the coronavirus response as is dictated by the CARES Act legislation. So my office will be reaching out to the media to invite you to come and participate in that event. I think it will be informative. I think it's an important aspect of making sure we communicate well with the people of Utah. So we would invite the Capitol media to participate in that program and look forward to that opportunity here the first of next week to give more detail on our contracts and answer some questions regarding those issues. So with that, although I won't be able to answer some of the questions on the contracts because I'm not involved with those, I'm certainly happy to take your questions now.
Yeah, Governor, Ben Winslow with Fox 13. We are starting to get public records requests showing the level of state spending with emergency procurement. So I wanted to ask you, do you have a sense of how many millions of dollars that the state has spent? And does this now mean with your just now, are you going to be winding down the use of emergency procurement powers?
We're going to continue. It's an emergency state, so we'll continue with the emergency powers. We don't have to make things quite in a timely fashion. It's not like we've had to make decisions sometimes in 24 hours. We've lost some of our PPE sometimes because of higher bidders coming in and buying the equipment that we wanted to have ourselves. As far as the total number, I don't know for sure. I mean, I've heard numbers in the 90 millions. You should know, Ben, that under the CARES Act for the state of Utah, $1.2 billion have been identified to go to the state of Utah to help with all of these issues. And we don't have much flexibility. We can't use it for other issues. It has to be COVID-19 related, and we have to spend it by the end of this year. I would expect, in fact, what I see happening is not only is it 1.2 billion, it's probably going to be more than that. It may be up to 2 billion when it's all said and done, that the federal government's going to send to us and the legislature to find ways to spend to help get on top of this issue. People are afraid. People are concerned. There's a significant challenge that we face with a pandemic. And this is worldwide. Again, it's unprecedented. So a lot of all hands on deck efforts. But we'll have an accounting for that. And again, we'll have some answers to some of those questions, maybe more in detail this next week. I can just say what I've said before. As I've looked into it, we've done our own internal review. I think everybody that I know of has dealt in good faith, trying to accomplish the goals of slowing the spread of this coronavirus, to protect people's health and welfare, to make sure we in fact protect people's lives, and as I've said, their livelihood, to have the economy not tank entirely, because that's another set of problems. And we've been pretty good at finding the appropriate balance and really threading the needle, I think, better than most. Have we done it perfectly? I'm sure not. But it's not because it hasn't been for a good effort on our part and a good faith try.
Hi there, Governor. Brittany Glass with KSL TV here. Can you hear me all right?
You're just a little fuzzy, but that's my old ears.
Perfect. Well, if you would, can you please just explain in what's been this no-bid emergency process, how have these private companies been chosen for these multi-million-dollar contracts? And how do you respond to critics who say there's action that's being taken behind closed doors to secure these contracts that ultimately should not have been taken?
Well, again, some of this has been people stepping up and saying, we've got an idea. We are inundated by people that say, we've got the solution. It may be a new drug, a new opportunity here, a new process, which we have to sort through. Some of the folks we know, some are new people. And sometimes you start on one trajectory and that morphs into something else. Our urgency really has caused us to have no bid contracts. You can imagine if we're trying to get PPEs or testing, which is critical. I mean, we still have states that don't have enough testing capability. And if you had to go out to an RFP, which is a traditional way to do it, and it takes you 2 months, that would be today. We'd finally be getting some results of that. That would be too late. So the situation itself necessitates quick action. And we've done that. And we've done it, I think, very responsibly. And again, if somebody's stepped outside their lane and done something inappropriate, we'll discover that and they'll be held accountable.
I have more of a clarifying question. You mentioned earlier that there had been some legitimate questions raised about various contracts. I'm just wondering if you can detail which contract specifically you're talking about.
When I talk about that, it's some of our communication internally has not been as good as I would have hoped. Between the health department, our Office of Management and Budget, our purchasing department, I think there could have been more precise communication. Again, I think you've heard the phrase, the fog of war. So I think our communications really have not been as good as possible. And so as we don't communicate as good as we're capable of internally in the government, we're obviously not communicating as well as we could with the public. So we'll find those out as we continue to go through the process of evaluation. I don't think anybody expects us to be perfect. We certainly aren't on this kind of a new quest that we're on of something that's never happened before. We have no playbook, as I said, to look into, no instructions, no recipe. We're kind of learning as we go. I said in the beginning, if you go back to, I think, my first press conference on this issue, I said, to me, this is like building a bus as we're going down the road at 60 miles an hour. Part by part, piece by piece, and not all of the parts fit. So we're learning as we go. It's a unique challenge, but it's one that we're up to the task. The proof is in the pudding. We see the end results. And I think that's the most important thing. We want to be able to get on top of this coronavirus. We want to stop the spread. We want to save people's lives. And we want to get the economy back to be as robust as it was at the first of this year, the best in the nation. And frankly, we're on track to do that. So we'll learn. Any recommendations, suggestions people have, we're open-minded about that and find a better way to do things. But I'm proud of the effort that's been made by so many. I appreciate those in the private sector stepping up. That's the power of capitalism. That's the power of the private sector. Say, I've got a niche in the marketplace that I can fill. I can find a solution. People from all walks of life coming together for a common good and a common goal. So I congratulate one and all. My last comment as we finish up here on my part of the program is to, again, let's make sure that we understand we're not out of the woods yet. There's still a journey to take place. I like the trends. I like the data. I like the stats that are driving us. We're trying not to let this be political. I see on a national stage, in particular, this has become politicized. That's unfortunate. It's Democrats versus Republicans. That's unfortunate. It shouldn't be that way. This is where we need unification and coming together. Again, it's easy to criticize and to money-morning quarterback. I don't think that's necessarily productive, but we do want to have evaluation and recommendations, and if we can find ways to do it better going over the next 8 weeks, we're all in. We're in this together, so Utah, stay strong. We're going to win this battle. Thank you.
Thank you, Paul. My name is Val Hale. I'm Executive Director of the Governor's Office of Economic Development, also known as GOED. In the recent special legislative session, the legislature passed and the governor subsequently signed SB 3006. This bill has three components to help mitigate some of the economic challenges caused by COVID-19. One part of the bill provides $20 million to help agricultural operations for the continuation of food and fiber in the state of Utah. This program is being administered by the Department of Agriculture, and details about it can be found at ag.utah.gov. Applications are currently being accepted and will be accepted through May 15th at 5 p.m. The second component includes $20 million for residential housing, and more information about that will be available from the Department of Workforce Services soon. The third component, and what I want to mainly talk about today, is a $40 million grant program called the COVID-19 Commercial Rental Assistance Program, which includes grants for renters of Utah commercial property. GOED will administer this grant program designed to provide rental relief to Utah small businesses and nonprofits that have lost revenue as a result of measures taken to minimize the public's exposure to COVID-19. Program applicants will be asked to attest that the grant funds they're applying for will be used for rental payments. To be eligible for the COVID-19 Rental Assistance Program, applicants must have a current lease on commercial property in the state of Utah, claim Utah as their principal place of business, have been in operation with fewer than 100 employees on February 15th. They must demonstrate at least a 50% gross loss of monthly revenue after March 1st as a direct result of the COVID-19 pandemic. And they must not have received funds from the agricultural grant program that I previously mentioned. An applicant determined to meet eligibility requirements will receive between 25% and 100% of a single month of its business lease amount, not to exceed $10,000. The grant percentage is based on a formula that takes into account two things: the company's loss of gross revenue and whether the company received funds from the Paycheck Protection Program managed by the U.S. Small Business Administration. There really are two categories of grant funds: those entities that did not receive PPP funds and those that did receive PPP funds. More details about the funding criteria and amounts of funding available can be found at coronavirus.utah.gov/business. Now here's the important part. Qualifying businesses, nonprofits, tribal businesses, sole proprietors, and independent contractors may apply for the grants at coronavirus.utah.gov/business beginning Monday, May 11th at 9 a.m. So Monday at 9 a.m., the application process begins. Completed applications are accepted on a first-come, first-served basis. To prepare for submitting your applications starting Monday, and to learn about grant eligibility and required documentation, I would suggest you visit coronavirus.utah.gov/business or go to GoEd's website where you can find this information. I would encourage you to go to the site ahead of time before Monday to find out what you're going to need to include with your application. The application process will remain open until all grant funds are used. GoEd plans to begin mailing checks for this program a week from tomorrow, Friday, May 15th. Tomorrow on GoEd's YouTube channel, we'll share a webinar about the program as well as a Business Elevated podcast discussion, which you can get from GoEd's newsroom or wherever you get your podcasts. It's called Business Elevated again. There are frequently asked questions and answers to those questions published on the grant program landing page on the GoEd site, business.utah.gov. And if you still have questions about the program after reviewing the criteria and the published FAQs, you can email us at rentalgrant@utah.gov. Again, that's rentalgrant@utah.gov. We know this $40 million grant won't help every Utah business or nonprofit with less than 100 employees, but it should go a long way to help many struggling Utah small businesses, which has been the focus of the Economic Response Task Force and GoEd since the pandemic began. In March and April, we distributed $12 million in bridge loans to help Utah small businesses and nonprofits. Now, thanks to Governor Herbert, the Utah legislature, and funding from the CARES Act, we have this new program with $40 million in rental assistance for Utah small businesses and nonprofits. Our hope is that these grants will help provide relief until Utah small businesses can get back on their feet. Now I'm available to answer any questions the media may have.
Thank you, Val. This is Chris Reed with St. George News. One of the things that was talked about a little bit, at least locally, was when there was an amnesty for rent for renters, for residential renters, that there wasn't one for small business owners who were suddenly finding that they weren't able to pay their rent for the month. Is this addressing that, would you say?
Yes, I think this program addresses that very issue. And so this, pretty much any small business owner that has a lease agreement is eligible to apply for this. And again, it's $40 million, and it will be available first come, first serve starting Monday morning.
Hi, Jacob Kloppenstein from KSL.com. You may have mentioned this already, so my apologies if you did, but just to clarify, these are qualified as grants and not loans, so they won't need to be paid back. Is that correct?
That is correct.
Okay, thank you.
Thank you very much.
Okay, good afternoon. All right, we have 5,724 cases of COVID-19 identified in Utah thus far. That's an increase of 129 from yesterday, or just a 2.3% growth rate. We've tested over 134,000 Utahns for COVID-19, an increase of 3,541 from yesterday, and we're still maintaining a 4.2% positive rate. Our hospitalizations have increased by 12. We have a total of 476 hospitalizations due to COVID from the beginning of this outbreak. And we are now at 61 deaths. That is an increase of 3 from yesterday. The first was a female, age 60 to 84. She passed away in a hospital in Salt Lake County. The second, also a Salt Lake County resident, was a male over the age of 85 who was a long-term care facility resident. And the third was a Utah County resident, a male between the ages of 18 and 60 years who was also a long-term care facility resident. So we've launched a new data dashboard on coronavirus.utah.gov today, and I want to point out a few key points that might be of interest to you. So the first is on our Overview tab. We now have a map showing the case rates by the 99 Utah small areas. What's important to note here is that those case rates take into account the cases from the beginning of the outbreak. So they're not current hotspots, they're the overall cases for the entire outbreak. We now have a tab for data on risk factors and exposures. And for hospitalizations, we're able to report current COVID-related hospitalizations. These are reported to us by hospitals on a daily basis by a self-report survey. And the numbers depend on when hospitals report and how they're counting their cases. So today we're showing 95 current hospitalizations of COVID-19 positive patients. We also are showing our incidence and epidemic curve. So when we're talking about flattening the curve, this is what public health is looking at. It's a way to visualize growth, plateau, or decrease in cases. So we're hopeful that these new data points will help explain to you kind of what's going on in the state of the COVID-19 pandemic here in Utah. I'm happy to answer questions.
Yes, I'm here. Can you hear me?
Yes.
Can you hear me? Hi, Dr. Dunn. I'm interested in a figure that is being reported on your dashboard now related to known contacts and is household and a raw count and a percentage count of 59.2%. I have a couple of questions related to that. What does that say about the danger of being in a home, in your own home, versus in another setting and your chance of contracting coronavirus? And number two, does that 59.2% include care facilities where there have been outbreaks?
So those, the household is just in a household, so it does not include care facilities. And what these numbers are really pointing to is our social distancing recommendations. So we're recommending that people only come into contact with their household members, and that's what's been in place prior to moving to orange. And so our contacts and our exposures are a direct reflection of those recommendations. So we expect that the vast majority of people thus far who were getting COVID-19, were getting it from their household contacts because social distancing was working. So we anticipate those numbers will likely change and those ratios will change as we start to open up parts of society. We might see more social and more workplace contacts because people will be in those settings more often. We're hopeful that people will maintain staying home when they are sick to limit the spread of disease when we are opening up these places, but those numbers are likely to change.
Doctor, may I ask a follow-up question?
Yeah.
And recognizing that the social distancing measures that you have mentioned are working, what do you say to some people who might look at this figure and think, my house is more dangerous than any other place in terms of contracting coronavirus? Again,
I mean, that's just by the nature of the disease and the interventions we put in place until now. Of everybody who's been diagnosed with COVID-19, they have so few contacts because people have been socially distanced that the most likely source of exposure is going to be their household contacts. So again, that's definitely expected. It doesn't mean your household is more dangerous. It just means that people are having close contact with their household members, which is expected. There have been national studies, and we've even had studies here done in Utah, that the transmission rate between household members is around 20 to 25%. And so that's what we can expect moving forward. And we definitely put prevention measures in place to help isolate individuals from their household members. But as you can imagine, that's pretty difficult.
Thank you.
Well, yeah, to be honest with you, my question was pretty much the same as Brian. There are, studies coming out of New York showing the vast majority of people who got the virus actually got it from home. Yeah. And there are some people that are saying, well, this means that the shutdown is actually hurting us. But it sounds like what you're saying, that doesn't necessarily jive with what you're saying. It sounds like from what you're saying, the shutdown has been working. Is that accurate, or what would you say?
Yeah, absolutely. I think kind of the statement you made is just a misinterpretation of the data. As society opens, people are going to have exposures outside of their household members and likely be infected due to people outside of their household. So that's why it's super important that people stay at home when they're sick. They maintain socially distanced measures when they're able to, and then they're wearing a mask when those social distancing measures are just not possible.
Okay.
Thank you, Dr. Dunn. Chris Reed, St. George News. Down here in southern Utah, leaders here are looking to, as soon as tomorrow, they're requesting that this area of the state move to a yellow phase, saying the area is being judged by the problem as it's being seen in more northern Utah, and it's a different kind of area. What is your opinion on that, and do you think that is too quick, or is that a possibility?
I think we've said this numerous times before, but I think it's really important to take a regional or local approach to the response and also kind of how we open up. And I think local health districts can look at their own data to determine when they feel it's appropriate. Of course, with any jurisdiction, we're looking for that downward trend or plateau in cases in accordance with a sustained number of tests. And so I don't have Washington County's data on the top of my mind, but I'm hopeful that they're being prudent in looking at their data and making those decisions to request going to yellow based on the data that they are seeing. Okay, thank you guys so much.
Thank you. That will conclude today's briefing. We will be back here Monday at 1:30, and we wish all Thursday. Thank you very much. Goodbye.